Welcome to Next Phase Human, where medicine meets performance and science meets longevity. I'm your host, Dr. Sandhu, and with me is Dr. Maheep Virdi, a board-certified neurologist. And today we are going to talk about dementia. Thank you, Dr. Virdi, for taking the time.
Thank you, Dr. Sandhu, for giving me this opportunity to spread the good word around to help people with dementia and have them understand what this is all about, what to do, what not to do, what is right, what is wrong, what does not have any substance, and what has a lot of substance.
I love it. That's what we're here for. So let's start with the basics. When people hear dementia, what do they usually think about and what do they get wrong totally?
Anybody who just forgets picking up the keys, loses the cell phone, loses the way around, which is normal human aging. And they have relatives which come along and they say, hey, this looks like dementia. The whole world falls apart for these people. It is like they think for the worst like everybody else. And it's more like, what am I going to do? My finances are going to be? Are the kids going to take care of me? Am I going to be in the nursing home? Am I going to be disabled and whatnot? And it is a cascade which takes them all the way into the rabbit hole, which is not correct.
So not all of those things are dementia.
No, they are not.
So don't assume the worst.
Don't assume the word. Get yourself checked, get a diagnosis, because most of the times this is just like getting aging. This is normal cognitive impairment which comes, and most of the times it's just mild cognitive impairment.
So they can still live their life normally.
They can still live their life normally. And most of the people that I've seen, they are high performers all their life. They've been CEOs, they've been doctors, engineers, doing all sorts of stuff. And if somebody is functioning at 95% of their ability and it drops down to 94%, they feel it.
And they think the worst.
Yes, they think the worst, that, hey, I'm not going to be able to do this, I'm not going to be able to do that. But that is not the real scenario.
Perfect. Is it, you see a lot of it now, and in your practice, you see a lot of patients with it. But is it dementia is happening more, or are we just diagnosing it more?
We are diagnosing it more because people are more aware. They want to get into this diagnosis, if at all it is right, as early as possible. Because 40 to 45% is the rate of diagnosis, is the incidence of dementia all across the United States. And this is a low number because most of the times people doing blue-collar jobs, they don't have the resources, or they are not cognizant of the fact that, hey, something is wrong and something can be done earlier for this.
And so dementia happens. Someone has early onset or has early stages of dementia. What is happening in the brain years before you actually start seeing that patient in your clinic?
Every person's brain is going to atrophy. This is normal.
Atrophy means get smaller.
Get smaller. Every brain is going to get smaller. Like, as we are becoming elderly in age, the muscles are shrinking, so the brain is also shrinking. And a lot of the times before you even have any sign or any symptom of dementia, the brain is accumulating the amyloid plaques. And it takes a certain amount of threshold for it to translate into clinical things. And this begins a lot early. Because normally amyloid plaque is something which is going to get detoxified and removed in a younger person. As we are advancing in age, that capacity to detoxify amyloid protein, it goes down. And what happens is it starts to get accumulate. And once it accumulates, it causes disruption of the circuits which are responsible for memory. And that is what we think causes dementia.
So that's a great point, and we'll come back to it as to how that system works. But I just want to kind of paint a full picture of dementia before we start getting into the details of it. So is Alzheimer's the only kind of dementia, Or are there multiple kinds of dementia?
We don't even use the word dementia anymore because of the social issues
Stigma
associated with that. So this used to be an umbrella diagnosis, and underneath that you get Alzheimer's, you get frontotemporal dementia, you get Lewy body dementia, Parkinson's dementia, depending on which part of the brain is getting affected differentially.
And all of them behave differently?
They all behave very differently, and they are different as in their presentation. They are different as in the way the patient presents. They are different in the different parts of, depending on different parts of the brain which are getting involved, and their rate of progression and diagnosis and the prognosis is very different.
Is it mostly genetics, or is it the life that we live?
It's more life that we live. Yes, the genetics, there are certain genes which are involved, but if you have a gene, it is not 100% you will get it. Maybe some studies have shown that if you have ApoE4 genes, there are two implications of that. One is that you may get the earlier onset of the dementia, but it's not 100%. It's not guaranteed.
So if someone gets their genetic test done,
it does not mean anything.
Okay, but they should see someone to get their risk.
If they, for some reason, they get their genetic testing done, or if they have strong family history, both parents, their parents, both sides of the family, they have incidents of dementia, it needs to be looked into to see what is the reason behind that. Because most of the times it is a combination of your lifestyle, drinks, drugs, stress, hypertension, vascular problems, and it goes on. Everything affects the brain.
So it's the life that we live that's more important. You're not born with a death sentence on this.
Correct.
Fair enough. So, see, we run into someone, 40, 45-year-old, healthy. What should I start thinking about brain health?
45-year-old, that is a threshold where a lot of people have a lot of stress in their life. It's a family stress, work stress. They are juggling 5 jobs at the same time, and they're not sleeping well. So there are a lot of variables that need to be looked into before we run the diagnosis of dementia. A person who is under stress 24/7, thinking, not even sleeping properly, they will miss some things during the day. And that is not dementia. That is basically depression, anxiety, workplace, personal relationships, and so on. Everything plays a role. So all those things have to be cleared out of the equation before you make a diagnosis.
Love it. And in terms of if they are sleeping less, obviously they're increasing their risk of future dementia.
Yes, they are.
So you mentioned a bunch of risk factors right now, a short time ago, the sleep, the alcohol intake, the high blood pressure, high cholesterol, stress levels. So pretty much the message I'm getting is what's good for heart is good for brain.
Yes, exactly.
Is that the truth?
That's the truth. That's the truth.
So in terms of, let's dive into some of the levers we can press for reducing risk. So sleep. If you could improve only one lifestyle lever, you mentioned like 8 of them, and there's more than that, but if you could improve just one lever, which would be the most high-yield one?
The most high-yield one is going to be a combination of reducing stress and having a good night's sleep.
And what is a good night's sleep?
It is, you need to have at least 7 to 8 hours of uninterrupted sleep with a few cycles of non-REM sleep, which go into the REM sleep, because REM sleep is where consolidation of memory happens. And if you're not getting into the REM sleep, you're not consolidating memories.
So if you keep waking up early in the morning, you're affecting that memory consolidation.
Yes.
And from what I understand, sleep has a big part to play in cleanup of the brain. Also, you mentioned amyloid plaque a short time ago. So what actually happens in the brain when you sleep?
When you're sleeping, the brain is functioning, but there is a disconnect between the brain and the rest of the body. It's not that when you're sleeping, the brain is also shutting down. No, that's not how it works. The REM sleep is where you consolidate the memories, and there's a disconnect. So there is a disorder which is called REM behavior disorder, which is I'm going a little bit off the path.
No, that's perfect.
But that is something in which the disconnect between the brain and the rest of the body is not complete. So people end up shouting, people end up sleepwalking, people end up punching, running, because the kind of dreams that they get for some reason, and we don't know why, it's always a persecutory kind of a thing. So the brain is not resting, it's not resetting itself if you have that.
And I mean, we talk about this glymphatic system that cleans the brain at night. So it's almost like the housekeeping system of the brain. When I close the office, the crew comes and cleans the office.
Yes.
So what's happening in the brain? That's when the amyloid plaque gets cleaned up?
It doesn't really get cleaned up, but it is because amyloid is basically a protein which is turned in a way, in a simple language, it is turned in a way, it is structured in a way that it is not getting absorbed. And what is happening is the reason why that is happening is we don't know why that happens, but all the factors that we've seen, they basically contribute to that protein, which is insoluble, which is not going to get absorbed.
So in terms of exercise, we know exercise is good for heart. Is it good for brain also?
It is good for the brain because the brain has a system called the autoregulatory system, in which the brain needs an X amount of blood flow per gram of tissue to function properly. Anywhere from 80 to 180 millimeter of mercury systolic blood pressure is going to keep that blood flow going to the brain at the same rate. It's not going to change. When you exercise, the blood flow actually increases because the brain has got a lot of collateral circulation, and that's different for everybody. And those collaterals open up, that gives more oxygen delivered to the brain. And the anatomy of the brain is such that there are no valves in the arteries in the brain. Blood can flow from, there are 4 systems, 2 anterior arteries and 2 posterior arteries. They have interconnections, and you have the external carotid, which also contributes to that. So the brain can get blood from anywhere and whichever way. So if you have a plaque in the brain in one artery, and if you're exercising, not only are you reducing that plaque, but you're opening up more channels.
That will cover that area in the event you have a problem.
Yes.
So you are actually creating a little insurance for possible future event.
Yes.
If you exercise.
That's what you're doing.
Does it apply to all exercises, high intensity, cardio, or weight training?
Cardio, weight bearing, mostly all of them. As long as you are able to do it, you should do all sorts of exercise, except for, doing cardio gets you more.
Cardio gets you more.
Yeah.
So I was reading some data on weight bearing exercises like deadlift, which involves a lot of muscles. And so that improves your coordination and balance, some of the balance exercises that we do. So they are all a part of that.
They're all a part of this.
So are there any studies or data that show that with exercise, you literally grow your brain?
No, there is no such thing as growing the brain. It is basically about just preserving the brain.
What about BDNF that improves the brain-derived neurotropic factor?
Neurotropic factors, there is no, for those, yes, there are multiple of those available in the market. But you
produce your own when you exercise?
Yes.
So that'll help grow the neurons, so to speak, maybe?
So to speak, maybe. But, the concept of neurons growing it is called plasticity. It's basically neuroplasticity. It is basically not really growing the cell or the neuron. It is basically forming more connections.
And that's what you need.
Yeah,
that's what you're looking for.
That's all what you need.
So you're retraining the brain if you exercise.
Yes. For example, if you have a stroke, then the theory is that we do sensory stimulation. Somebody has right arm is not working, which is coming from the left part of the brain. And when you are doing physical therapy, it is sending sensory input to the brain to make connection and sends information across the corpus callosum, so that the
corpus callosum is the connection
between the right and the left. So the right side of the brain is going to take over the function of what is lost in the left brain.
How interesting.
Yeah.
So they can actually, even after stroke, they can regain function with the right kind of physical therapy.
Yes.
What about nutrition? It's a big part of what we do.
It's
What hurts the most? What hurts your brain the most?
alcohol, drugs, and cocaine. It causes vasoconstriction, decreases the blood supply to the brain. And any sort of recreational drugs, they do affect in a long-term basis.
Is there alcohol? Does it affect the brain in a negative way?
Yes, it does. And no amount of alcohol is safe.
So not even one drink a week?
As long as, I would.
As long as you know you're drinking poison
yes,
for the brain. That's fair. So is there anything, like if someone enjoys drinking, is there anything in particular they can do to help their brain or protect their brain?
Drink responsibly. That's what I would say. There are
and
studies
to the least amount.
Yes, the least amount. Because there has been a recent study from Europe which said no amount of alcohol is safe.
So you are killing some brain cells.
Yes.
It's just how often you do it.
Just how often you do it.
Is there any particular diet? Mediterranean diet is good for heart? Is it good for the brain also?
There's really no data behind that. As long as your cholesterol and your LDL cholesterol remains within limits, and as long as you have good protective cholesterol and you're eating, yes, Mediterranean diet is not per se in studies better than any other diet, but it won't do you any harm.
Is there any particular diet that's shown to help, like ketogenic diet or like plant-based diet, or there's all kinds of...
There's all kinds of that, but
none of them
have shown.
So in general, what would be your message if someone were to ask you, okay, to help my brain, what kind of diet should I eat or what should I avoid?
Basically, you should avoid fatty foods. Basically, you should avoid something which pushes your cholesterol up, because as the cholesterol builds up into your arteries, and everybody is different. Some people can have bad food and they're still fine. And I have not been able to figure out why that happens. And some people, they are genetically built up in a way that they cannot metabolize the fat and things like that in the proper way. And that leads to accumulation of that in their arteries. So as long as you are having a diet and you're looking at the numbers of your cholesterol, looking at numbers of your LDL, looking at HDL, triglycerides, as long as you're keeping that in check, it should be fine.
So I'm going to wade into a little bit of controversy. There's a lot of talk about dropping cholesterols too low, which we do for heart disease. Does that increase dementia risk?
There are no real studies behind that. But yes, the one thing which brings to attention is, and there's data behind that, if your cholesterol is too low, if you drop it too low, then you have a risk of a brain bleed.
And what is too low?
When we talk about risk factor management, if a person is a diabetic, if the person has hypertension,
stay within the guideline directed.
About 70, less than 70 milligrams of LDL should be less than 70, but it should not be 5 or 7. Anywhere from 60 to 70 or 50 to 70 is good.
Reasonable. You shouldn't target a lot lower than that. Fair enough. Does fish help?
Yes, fish does help. It doesn't build up your cholesterol, but it's good food. So
any particular kind of fish? In general, salmon, like?
Usually everybody eats salmon, so that helps.
Ultra-processed foods help?
That's my personal opinion. It is, you have to use that with caution.
So minimize
it.
So again, what's good for heart is good for brain.
Yes.
So what recommendations have the strongest evidence and what's all just hype?
As far as
the diet and dementia that we just talked about.
Healthy diet is going to be there. Keep your blood sugar in control, keep your blood pressure in control, do as much as exercise as you can, because anytime your heart rate goes up, anytime your blood pressure goes up, it opens up a lot of collaterals, at least in the brain, and that is protective.
And it's closely tied. You mentioned about blood sugar. It is closely tied to metabolic health. So even like it's called the diabetes of the brain when we talk about dementia. Is that true?
Yes, it is true, because diabetes, if you are an uncontrolled diabetic and if your metabolism is not doing well, then you will have effects on cholesterol, effects on plaque deposition in the brain, effects on arteries hardening up, effects on low blood flow to the brain, and so on. So that way it indirectly causes damage to the brain.
And insulin resistance, it starts with that and all the way to diabetes.
Yeah.
So even if you have pre-diabetes or insulin resistance, is that increasing your risk of dementia?
In some studies, yes.
And so to summarize in terms of metabolic health, good blood pressure,
good blood sugars, keep your cholesterol in control, have a higher HDL level, low LDL level, triglycerides, they have to be low enough, and this helps.
Got it. Now, a component that's not talked about much for people with dementia is the social health and connections.
It's good you asked this question, but it's a known fact that you need to have to work your brain up. You need to be active enough mentally. You need to be socializing, because that is sort of a venting of all your stress and all that goes on in your brain. And I have actually seen this thing that once patients or people, they are put into the so-called memory care facilities, and it's basically seclusion. They are not talking to anybody. There's no social life. Some of them, they have those facilities, but if you put them in a facility where there is no social life, their dementia gets worse and worse and worse. So
social connection, loneliness will actually damage your brain.
Yes, because loneliness will give you depression. A person who'd been functioning well all his life, has accomplished a lot, and one fine morning, just because he cannot remember something, he is sort of taken out of, not for any other reason, not for vicarious reason or something. It is just the family wanting to make sure that the person is safe. But once you withdraw them from everything, depression sets in, psychiatric illnesses set in, and that worsens the dementia.
So it feeds the loneliness, and then,
yes,
of course, the brain connections.
Yes.
Purpose. It's talked about a lot when people retire. Generally, the cognitive capacity, if they don't stay involved with something purposeful,
it will go down.
It will go down.
Yes.
So when you retire, what's the number one recommendation?
Well, find a hobby, do something with your time. It doesn't have to be tied to, let's say, making some money or doing some project and things like that. You can do a lot of things for your own happiness. You can travel, you can have parties, you can have like-minded people talk, and it's
keep yourself intellectually
stimulated.
So you mentioned depression and anxiety before. Do they worsen dementia, or are they just kind of associated things that hang out in the same?
They are associated, but when you take the social part of the person's day-to-day life out of what they want to do, these underlying depression and anxiety, they do get worsened, and then it's a cycle which feeds onto itself. They also disrupt the neurotransmitters, serotonins and dopamine and all that, and it becomes very complicated at that point, and it feeds into each other.
So they coexist.
Yes.
And we live in a world in which stress is very, very common. Does that affect your risk?
Yes, it does.
In what way?
Because if you're stressed about something, your mind is never resting. Sleep goes out of the window for the first You're not getting adequate sleep. You're not getting rested enough. Your brain is not resetting enough. And there's always something going on in the back of your mind.
Right.
And that is going to cause loss of memory here and there. You'll miss things. You will not be able to function at the top of your ability. And that then the other things down the line, like depression and all that, anxiety comes in. And then it's a free fall.
Does meditation help?
Yes, meditation helps because it keeps you calm.
Is there any data on that?
I'm not too sure about that.
So in moving along, modern medicine, we'll go through medicines and supplements when someone has like concern of early dementia or whatnot. So I get this question a lot, and I'm sure a lot of people out there are wondering, are there any supplements that help with this?
There is minimal to no data.
Okay. So there's a lot of talk.
There's a lot of talk, but there is no controlled studies behind that. And most of the times, it may help if it is a combination of vitamins, magnesium that helps you have a good night's sleep. It can help you with vitamin B12. Although the literature does not suggest that vitamin B12 helps, but generally it gives you a good feeling,
sense of well-being.
Sense of well-being.
Omega-3s, fish oil.
Fish oil, in my opinion, they would work indirectly by helping lower the cholesterol and decreasing the risk factors and keeping those risk factors at bay without using pharmaceuticals. So they can help in indirect way.
Creatine?
There's no data behind that.
So it can help in the short term for the memory. There is some suggestion of that with the exercise training and brain capacity.
Indirectly.
But not in terms of dementia.
No.
Vitamin D?
Vitamin D, bone health, and it can help with memory issues, but most of the times it is. And it also helps with the general well-being.
And things like bacopa or ceticoline?
There is no data behind that. It is in, for example, in Bacopa moneri, in the Ayurvedic line, ashwagandha and all that. They have been shown in some studies that they help, but there is no standardization that if you take this much, this is going to happen. And most of the times they may interact with other medications that the people take, can affect the cardiac medications as well.
So may work, but talk to your physician.
Talk to your physician.
Hormones. So menopause, does it affect the brain?
Yes, it does.
The estrogen, the progesterone?
Progesterone, testosterone changes, they all affect. They basically, affect all the neurotransmitters. And that's how it can. It's not per se that it will give rise to dementia, but it is more so that it can cause mild cognitive impairment and or it can cause other things like depression, anxiety, and that can indirectly translate into, I'm not doing the same thing which I was doing earlier. So menopause had hit me. I'm more irritable. I'm not concentrating. I can't do the same things which I was doing earlier. So that is an indirect outcome of that.
Hearing loss. Is that
That contributes to dementia. It's not straight up that hearing loss is going to cause dementia, but if you're not hearing anything,
then you're not getting
enough information. You're not stimulating the brain enough, and then it. So in my experience, it has sort of gone to an extent that patients who are not hearing properly, the family members most of the times actually, they start thinking, oh, this is dementia. But no, it just contributes to, because if you can't hear anything,
of course,
you cannot process it.
Yep. Does the vision work the same way?
Vision, yes. If you can't see, it will contribute to this.
Dental health.
There is some studies that there are some microbes in the gums, in the saliva, in which can contribute to dementia. So dental health has to be maintained. You have to have your cleanings done at the right time, and anything wrong with the dental thing, it has to be. There is something available in which they swab the mouth and they look at all those microbes. And there are some studies which have said that if you treat these microbes, that can help with
even reduce dementia risk.
Yes.
Oh, interesting. Sleep apnea.
Yes, it is working towards dementia in an indirect way, because if you have sleep apnea, you're definitely not going to go into REM sleep. And you're waking up, nighttime awakening. You have your breathing stops. You wake up gasping for breath. And for that time period in sleep apnea, once your airway closes, you have hypercapnia, which is basically increased carbon dioxide in the brain. And that can affect dementia.
And so do atrial fibrillation, irregular heartbeat.
Same thing, bottom line, if you have AFib, you're not pumping enough blood to the brain. And there is a certain limit above which it is, I think, about certain ml of blood per gram of brain tissue that has to be going there. If you have AFib, if it decreases below a certain level, you're not getting enough oxygen.
There is some data in the AFib world on ablations actually helping with reduction in risk. So treating AFib.
Yes, treating AFib is important because not only you reduce the risk of a stroke, but you increase the benefits of, you have more benefits with that.
Smoking?
It's a no-no. Smoking is one of the biggest risk factors. It is like riding a motorcycle. It's not if at all you're going to get dementia. It's how soon you're going to get it. Because
vaping is the same?
It's the same thing.
So both will increase your risk of dementia.
It will increase your risk. Cognitive impairment comes in. People who have seizures, if they have seizures which are not controlled, they're not taking medications for that, it will cause cognitive impairment, because once you have a seizure, it's basically like two wires shorting in the brain. There's immense amount of uncontrolled energy being produced, and that causes brain tissue loss.
Oh, interesting. Now, going into kind of if someone starts thinking, who should be screened? Like if you get asked for clinically for a patient.
Anybody who, if you lose your keys somewhere, if you didn't remember your appointment, and you're in your 40s and 50s, that's normal. Until and unless it is something which is consistent, until and unless there is an obvious decrease in your level of functioning. And it could very well be, like I said earlier, it could very well be something like underlying dysthymia or depression or stress, lack of sleep, and things like that. But if any of those symptoms come on, if you are not able to function at your previous level of functioning, you should consult a physician.
That's when they should see a neurologist?
Yes, that's when they should see it.
And so you mentioned a little bit about that. What are the earliest warning signs someone would see that should concern?
Asking more questions, same thing over and over again to the family members. Where am I going today? What appointment do I have today?
So a pattern of it, not just one.
Yes, not just one time. Pattern of it. Asking the same question 5-7 times in the same day. Not remembering, which I've heard very, very commonly, not remembering what I ate in the morning or what I had yesterday. And getting lost around familiar places. This is a grocery store. I've gone there all my life. And I suddenly am at a crossroad and I don't know which way to turn, right or left. That is concerning.
It can happen once to everyone.
Yes, it can happen once to. It has to be a pattern. It has to be consistent. It is happening more often than not.
And when they come to you, what do you typically do? Are there any blood tests you start with?
We usually start with imaging. Do the MRI, and now there's a PET scan available in which looks at the amount of amyloid. It answers two questions. One is the amyloid present or not? Two is, if the amyloid is present, what is the centiloid value? How much of that is there on a scale of 0 to 200? And that gives us an idea about, is this relevant? For example, if somebody has amyloid is positive in the PET scan, it's a yes or no. But if the centiloid value is 15 out of 200, it is not really important. This seems more likely to be mild cognitive impairment, which is age-related. Now, if the centiloid value is 175, we need to do something about it.
And that does come in correlation with symptoms. Also, if someone has no symptoms, could they do the scan to screen? Is there any value to it? Or this is more fraught with risks?
This is more fraught with risks. Because if you have to have a clinical suspicion for cognitive impairment, and the reason we do this amyloid scan is, and this is meant to, so why do we do this? The reason for that is, now there are some medications available which can help scavenge that amyloid out of the brain. And they can help with reducing the risk of worsening at about 1.5 to 2 years. They come with their own risks. The medicine treatment comes with its own risk. But if we clinically think that, hey, there is a suspicion of early cognitive impairment, I'm not even labeling it as Alzheimer's right now. We do the scan, we look at the amyloid plaque, if yes or no, and then we look at the centiloid value. If the patient is symptomatic and the value is higher, then we do further testing to look at the risk the person has of any adverse event with the treatment. Because they can cause you to have bleeds in the brain, they cause swelling in the brain. About 1% in the studies had a large bleed in the brain, and there's nothing that we can do about it.
Is there any clinical exam that you do when they come to you to kind of give you an idea?
It is, we run tests, which is basically questions and answers, and a couple of them. There is a lot of neuropsychological testing available in depth if we need it, but the regular screening is done with MOCA and MMSEs, and that translates the memory capabilities and executive functioning and so on into numbers.
So it's mini mental state examination.
Yes, mini mental status examination, and a perfect number is 30. And 20 to 30 is mild cognitive impairment, 10 to 20 is moderate, and less than 10 is severe.
Any blood tests like ApoE checking, plasma p-tau checking, or amyloid checking,
It does help corroborate the diagnosis.
So not as a diagnostic tool, but corroborating.
Not as a diagnostic tool.
Got it.
And there is one test which is called ApoE4, which we do. It is it's a genetic test, and you can have 2 copies of that. If there are 2 copies in your blood, it doesn't mean that you have dementia. That's not what we are doing it for. Because if you have cognitive impairment, and if we plan to go towards using these newer medications, which are monoclonal antibodies for scavenging the amyloid, then we have to check that, because if you have 2 copies of ApoE4, then your risk of having a bad outcome, as in a bleed in the brain, is high, and then you're not a candidate. If you have no copies, or if you have E3 or E2 or just 1 copy of E4, then your risk is as good as anybody else.
So there is some value to checking those.
Yes.
In terms of drugs, it's an exciting field. There is some new therapies that you use. What are the new anti-amyloid drugs? Do they actually work?
In the studies, what it showed was that 30%, you have a 30% less chance of worsening of your cognitive abilities at about 1.5 years. The studies they were done for about 1.5 years, and we have no data behind that. no data for more treatments after that. But companies are working on it. There are trials going on to see if continuing with those infusions for the patients beyond a year and a half, is it going to be helpful or not?
And is there any downsides to those therapies?
Yes, there is 8% chance of having ARIAs, which is amyloid-related imaging abnormalities, which can be small punctate bleeds, very small bleeds. It can be swelling in the brain. And there is a specific protocol that is used for each one of these medications, in which regular MRIs are done at certain intervals and to pick up any small bleed. If there is a small punctate bleed, we stop the infusions, and most of the times nothing happens. It goes away. But if it is a large bleed, then there is just no treatment for that.
And there are oral medications which were talked about a lot before. Do they do anything?
Best case scenario, and this is what I tell all my patients, best case scenario with these medications is if we can stop the deterioration, keep the numbers reasonably around the same ballpark figure, and if you get any improvement in your cognitive scores, that's a bonus. These medications don't come with that many side effects because we are basically targeting the acetylcholine levels in the brain, bumping it up. Yes, people can get dizzy, people can get adverse reactions, but they are not, by and large, 80% of the times, there are no side effects from these medications.
So older medications do a little help, but not too much hurt.
Yeah.
And the newer medications may help a little more.
May help a little bit more, but it comes with its risk.
It's risk. So anyone who, like, if there's a person listening who feels that, or who is diagnosed with early onset dementia, what should they do to maximize their chances of a purposeful life?
Get the risk factors in control, get their health in order, exercise, no smoking, no drinking, no drugs, and of course, depends on what their level of functioning is. If it is significantly getting worse and it's early onset, then trying the newer medications is beneficial. I have patients in their 50s that I've treated with this, and there was significant, and it's all evidence-based. There was significant decrease in the cognitive abilities as far as the numbers are concerned.
So there is hope for improvement.
Yes.
Doing things right.
Yes.
Just short, rapid fire, things that help or hurt. Coffee? Up or down?
I don't know.
So may help, maybe?
Maybe.
We talked about creatine already. Crossword puzzles, learning a language, those kind of things.
100%.
They help.
Yes.
So done early in life, you're setting yourself a little bonus.
Yes. The ability to learn a new language is the max in pre-adolescent time. And then, yes, you can learn a language, but you'll need to do a little bit more. But if you keep on doing that, if you try to learn a new language, yes, you won't get to know that in 6 months. Maybe it'll take a year and a half, but it does help.
You're forming new connections. So you reduce your risk of dementia.
Yes. Weightlifting,
Walking after meals.
It does help reducing your risk factors. Cholesterol keeps your blood pressure in check, keeps blood sugars in check.
Is there any benefit to GLP-1 medications that everyone seems to use now? No data yet.
No data as yet.
May help with you, but you're extrapolating.
Yes, but indirectly, if you lose weight, your other risk factors, your blood sugars are going to come down, your blood pressure is going to come down, you're losing weight, your insulin sensitivity is going to increase. So indirectly may help with this, but it is there's no data behind that as yet.
Is Alzheimer's largely preventable?
Yes and no. I have had patients one of them is actually 103 years of age.
Wow.
And that lady is sharp as a tack. You can have a conversation and she is quick to respond to things. There is absolutely no cognitive impairment. And there are multiple patients in their 90s that I have seen who don't have dementia. And it is basically about reducing those risk factors. They have no history of any alcohol intake. They have no history of any smoking, no drugs. Blood pressures are good. Cholesterol is good. They hardly take any medications, which is surprising at that age, but they don't have it.
Interesting. Is there a big role of prevention even after you have early onset dementia?
Early onset dementia, like we reiterated earlier, and I'm going to reiterate it again, if you have cognitive impairment, you should be at the top of your game to reduce and control the risk factors as much as you can at that point.
Is there anything that everyone over 50 should screen, or it'll just create more anxiety?
It'll just create more anxiety.
So not everyone, unless you have symptoms.
Yes, unless you have symptoms and there are other stresses in life, your cholesterol and your numbers, as far as your primary care physician is taking a look at regularly, if they are out of whack, then you need to get checked.
Do you see artificial intelligence diagnosing dementia earlier than neurologists?
No.
Not yet.
No, not yet. Because there are so many variables. Because let's say the most easy example for this is if you do a PET scan, it shows that there is amyloid, but the amyloid value, centiloid value is less than 50. The patient is not having any symptoms. The AI is going to diagnose you with dementia, but that is not really what the case is.
So you have to put it in clinical perspective. We may get to that age, but not yet there.
Clinical perspective, talking to the patient, listening to the patient, and understanding what the social factors are. So these are the variables in this equation, and which I don't think AI is at this point of time. It has enough data to extrapolate that into a yes or a no.
So there is like different kinds of dementia, and you see a lot of that. Now, Lewy body dementia.
Yes.
It's feared. Is that for the right reason? What is it and what does it do? How different?
So Lewy body dementia is one of the subgroups of dementia, which is different from age-related cognitive impairment and from Alzheimer's. What happens is you get Parkinson-like symptoms. Patients have hallucinations. They have tremors. They have difficulty walking. And there's Lewy bodies, which gets deposited in the brain. The difference from the others is one is there is no treatment available for that. The regular medications which we use for Alzheimer's and cognitive impairment because of age, they don't work in this. And it will give you good days and bad days in the patients. The families usually 99% of the times they see, hey, my dad has been doing good for 5 days and suddenly something decompensates without a reason. And the next 4 or 5 days is hallucinations, behavioral changes, can't walk, have tremors, and so on. So, and then suddenly the next morning, after 3-4 days, for whatever reason, the patient is going to be good for another 4-5 days. But there is a slow decline, a progressively slow decline over a period of time. No treatment, is very aggressive, and it's just symptomatic management.
So really not a whole lot that can be done, unfortunately.
Not a whole lot that can be
done. So what excites you the most about the future of dementia care in the next 5 years?
The removal of these plaques has helped, and hopefully there is going to be some research to take the Lewy bodies out, maybe, and that'll help patients with Lewy body dementia. The bottom line is, if the brain is, for example, in frontotemporal dementia, the frontal lobes are gone, the temporal lobes are gone. They are atrophic more than what the parietal lobes are. Once you start losing the brain cells and the brain mass, there's not much you can do. So I think the future of this would be to figure out how early can we diagnose something and find something which works in the early phases. And this is what has happened with Alzheimer's in today's date and age. The medications which are available, they have not been working for people with advanced dementia, and they're not even recommended for those. It is all about prevention, prevention, prevention. As early as we can do it, the better it is.
So I don't want to kind of beat a dead horse, but as you reiterated before, the biggest vaccine on dementia is your lifestyle.
Yes, lifestyle, health, and reducing the risk factors. That's the best way you can do it.
So let's go through them to summarize. Exercise,
Healthy eating, no smoking, no drinking, no drugs. Keep yourself mentally enrolled into day-to-day life. Keep yourself stimulated. Challenge yourself, and keep a lookout for any risk factors.
Last question for people who are taking care of their parents or near and dear ones with dementia. And a lot of times they have to make these difficult decisions who should care for them. Sometimes they go into these facilities. If they go to checkout facility, what should they be looking for their near and dear one from your perspective as a neurologist?
I get this question 200 times in a day. And in my opinion, and it has been proven, you should always look at a facility in which it's just not a nursing home. There has to be some sort of engagement, some sort of a social network there. There should be some regulatory things there in which it's just not that you're leaving a human being there just to wait to die. There should be some semblance of normal life, and the more you keep these patients engaged, these people engaged, the better is the outcome.
So they should have social engagement built into their day.
100%.
Not stay in their room. And
not stay in their room and wait out their days. No, there has to be social engagement. That's the bottom line.
This has been very good, Dr. Virdi. Thank you.
Thank you, Dr. Sandhu, for getting me here, and I really appreciate this opportunity.
Thank you. Perfect. We're right on time, huh?